Good afternoon, everybody. This is Dr. Markle, and welcome to our second installment of Quarantine 101. Today, we're going to talk a little bit more about focused on orthopedic care and talk about if your body is ready for the reopening. And last week, if you remember, we more generalized talking about overall immune health and how, one, it can protect you against infections such as the COVID that's going around right now, but also your own body's immune system helps your overall inflammatory process in your body. So controlling that, and some of those supplements and tips that even Renee went over about your posture and how your respiratory system can improve can also help your overall pain as well. And the good news is our stay-at-home order, if you live in Colorado, is now more of a safer at home. On Monday the 27th, we're actually getting back opening, full opening to the ability to do elective procedures again. So if you have been dealing with a lot of pain, we now have ability outside of some physical therapy and some other modalities, we can treat you in office now. But we're still continuing our physical distancing as well as a lot of safety protocols that are going to be in place. So we still have, even if you don't want to come to the clinic and get evaluated, we still have that ability where we're still probably, even for the foreseeable future, once this COVID calms down, we'll probably still continue to do the telemedicine. But also now we have the option to bringing you in office and treating you appropriately as well. So for those of you that don't know me, my name is Dr. Markle. I'm one of the interventional orthopedic physicians here at Centennial Schultz Clinic. I'm board certified in physical medicine and rehab and fellowship trained in interventional orthopedics. Now I've been considered a expert in the field of regenerative medicines with the use of platelet-rich plasma, stem cells, or bone marrow concentrate, publishing multiple publications throughout the use of stem cells and PRP for various orthopedic problems. I also am an instructor teaching other physicians from around the world through an Interventional Orthopedic Foundation, now known as the Interventional Orthobiologics Foundation, as well as I give lectures on stem cells, PRPs, both domestically and internationally now, on the use of some of these through some of our colleagues. Now, a lot of the patients that come, a lot of questions come up. It's like, what are your typical patients? So who's really a candidate for any regenerative medicines, whether it be PRP or stem cells? Now, we've treated patients, me personally, anywhere from a 13-year-old Olympic gymnast all the way to a 90-year-old man whose goals are obviously different, but we're able to treat both of those categories and everything in between, and myself included. Now, I'm also an avid rock climber, snowboarder, scuba diver, as well as a big CrossFit enthusiast as well. I am a CrossFit level 1 physician, so part of the CrossFit Health, so really advocating for health, nutrition, and fitness to help protect you against any disease as well. Now, today's special, we're also going to bring in a patient of ours to discuss about some of his treatments, his experience, and he's also worked with Renee, our EGOSCU specialist today. And Renee will also introduce yourself now.
Yes, thank you, Dr. Markle. I am Renee, proud alumni of Michigan State, owner of Pain-Free Body, and practitioner of the EGOSCU method. I have been collaborating with Dr. Markle in the Centennial Schultz Clinic for several years now. And then patients really like our continuity of care. And you will meet Hal, one of our mutual patients, later on today in this presentation. I had to throw some adventure photos up here too, because Colorado is opening soon. And you can see that I'm still distancing myself, but also have masks on. And clearly this is not from most recent, but I had to highlight some pictures as well. So to get on the base of telemedicine, Pain-Free Body has successfully been providing virtual sessions for over a decade. And while these Zoom webinars are great and can feed the masses, I can also meet you one-on-one and a personal level almost anywhere in the globe. So as a reminder, if your surgery has been postponed or canceled, or if you're in pain, or if you're starting back up with golf, for instance, because everything is starting to open, I can help you in the comfort of your own home. I'm able to treat individuals much like I would in person. And sometimes people are telling me they're liking this method a little better because you can have accessibility in your home, in your office, on the beach, on the patio, and then, or golf course. And then recently, if you see this young lady here on the above picture, she called me while she was on a remote motorcycle ride which is pretty phenomenal. And we did a quick balancing exercises on her stop, and then she was on her way. So literally anywhere we can connect.
Perfect. So now we're going to talk a little bit more specifically about orthopedic problems and one, how we treat them and how we think about them. Now, most orthopedic physicians around the globe are very focused. You go to an orthopedic doctor, he's the knee specialist or a spine specialist or an ankle specialist. Everybody super specializes in their field, depending on where your pain is. The problem with pain, it could be related to everything upstream and downstream from a kinetic chain, biomechanics. So from a global aspects, that's what we look at. And when you're having an evaluation with us, some people are wondering why, like, we spend an hour long with patients, whether it be the telemedicine or whether it be in person, so we can evaluate everything from your diet, nutrition, as we talked about last week, that can help your overall immune system, inflammatory response globally, because your nutrition also helps your overall pain. And the healthier you are, the better patients respond to their own platelets or bone marrow, or even recover from a surgery. So that's super important. But then when we start talking about independent areas, then we start talking about your articulations, basically your cartilage of your joints that are becoming painful. And then not only your cartilage, then we start looking at your stability. Well, what's the underlying cause of the cartilage loss? Is it your ligaments that aren't supporting your ankle or your knee properly, or your hip or your back? So we actually have a way to evaluate that. And when we're in the office, we do what's called the diagnostic stress ultrasound, where we can actually stress all those ligaments and look at how well they function. So if they aren't functioning properly, well, that's also contributing to the ongoing pain that we're dealing with. So treating that is going to be part of our algorithm. Then we also talk about the neuromuscular system. So a nerve in your back controls your quads, controls your hamstrings of your knee. So almost like a timing of an engine. If that timing isn't perfect, well, it's going to destroy the engine. So same thing happens with anything that those nerves control. If those nerves aren't working properly, well, that can contribute to malalignment of your back, malalignment of your legs, and overstress part of your joint pertaining to that decreased articular cartilage. And so when we're evaluating patients, we're looking at all this. We want to make sure we can not only treat the problem, but also treat the underlying causes of the problem. And lastly, your overall symmetry. So how well is your body aligned? And this is one thing that Egoscue really helps with, because we are able to address a lot of these issues, but biomechanics and your overall alignment, how your body moves in space, is a huge component of your ongoing pain. So that's why it's always worked well having treatments, as well as making sure make a focus on your rehabilitation afterwards, so you can get the best out of any treatment, or even if you don't have treatments, just so you can function the best. Now, Renee?
Yes. So pain-free body utilizes the Egoscue method. And just like Dr. Merkel said, we also look at the body as a whole. It's a postural alignment approach with gentle exercises based on fundamental anatomical, physiological, and biomechanical movements. Basically, that's saying we look at the body as a whole. And order really matters. And so I really like this quote that says, we first make our habits, then our habits make us. And that's really seen if we sit a lot or stand a lot, or like Dr. Merkel with the lead on for hours and hours treating patients, this can affect your load joints. And your load joints are your shoulders, your hips, your knees, and your ankles. And we tailor programs to meet your needs, whether it's time constraints or abilities. We can start with 10 minutes, but when I meet with you, we meet for an hour to an hour and a half. So we really get to know you as well. That's why this continuity of care with Dr. Merkel in the Centennial Schultz Clinic has been really great. And so I also have a lot of clients right now who are frontline workers. And if some of you are on this call, or if you know people, we really, really thank you for all your work that you've been doing. And I've also been having the ability to give them quick tools to get out of back pain during their shift. So that's really invaluable, to be able to go and do a simple exercise and then come back to treating patients. And then when I talk about order matters, I always like to remind people my last name is Cherry. And while cherry picking is great, cherry pies are the best. So you want to follow the recipe / the order in this case. And we can move on to Jack Nicklaus right here. So he is a winner of 18 major golf championships. It's pretty remarkable. And he states if it was not for the Egoscue method, his career would have ended in 1988 rather than 2005. He actually was told he needed a disectomy and a spinal fusion. Both are pretty significant surgical procedures, and he almost stopped playing golf due to back pain. So as Jack stated himself, the Egoscue method totally changed his life. It helped him avoid surgery and successfully extend his golf career for 17 years. That's pretty remarkable if you ask me. And so we're looking here at simple posture movements. And if you were on our last call or our last webinar, thank you. And some of you may notice a different posture alignment today. And so I would like everybody to please remove your shoes, stand up, and remember that our primary objective is to remove postural dysfunctions through collaboration. So let's go ahead and stand up and close your eyes and notice where the weight is distributed on your feet, left to right, front to back, inside, outside. Are you swaying? Sometimes that happens. All right, go ahead and open your eyes and look down at your hands. Do you see the backs of your hands? Is one hand in front of the other? Does one arm look different than the other? This is just a simple posture check to kind of start along with what we're going to do, as we're going to do some exercises later today. So if you've noticed that you're deviating or you have some swaying, the good news is all we really need is motion. The right motion, though, is what will get us back into alignment. And then I also want to think, I got a lot of feedback from those last week who joined that they had better alignment in their shoulders and they felt more stacked. So we're looking here at what Pete Egoscue says is our bodies are motion machines. He stated, golf to me is painful, or going to the golf range is painful for me. And what did he mean by that? It means it hurts me to see golfers force their body through the range of motion through the swing. So if we've been sitting here for a long time because we can't go to work, or on the other spectrum, we've tried new exercises at home with videos and hurt ourselves, we need to make sure that our bodies are set up for this reopening. And so I've also actually added a video here with extreme adventure athlete Eric for you to get motivated by. He's actually a blind adventure athlete. So if you have time, I know that you can get the link. So thank you. And then let's move on to some exercises. So I'm gonna hand it over to you, Dr. Marco, while I get set up, and then we'll get everybody moving.
Yeah, so as Renee gets set up, let me tell you a little bit about Hal. Hal's a 72-year-old male who, like a lot of our patients, are semi-retired, and one of the biggest things he's always wanted to do is just play golf and live his life normally without any pain, play with his grandchildren. And over the years of treating him, he's had various, unfortunately, car accidents that have exacerbated everything. He's had a lot of spinal stenosis, meaning some arthritis developed in his back, as well as some narrowing around his spinal cord, as well as some scoliosis. He's torn some rotator cuff tears, as well as has a lot of neck pain that's happened as a result of a lot of the car accidents and traumas. And we've been treating him at the clinic for probably several years now. And then he started seeing Renee in conjunction with us during that time. It does look like Renee's all set up. So let me stop sharing this so we can get to Renee.
Great. All right, hello everyone. So if everyone could stand up with me and try, we're going to do a simple hip functional motion test. And when I say simple, I'm referring to more like quick. So it may feel a little uncomfortable. And if anything is uncomfortable, stop or just go slower. So the first thing I want you to do is turn your feet straight forward and have about a fist width distance. So it may feel more narrow than you're used to, but we're looking at shoulders over hips, over knees, over ankles. What we're going to do is bend or fold forward. And I'm going to turn from the side here, because if our hips are not mobile, what will happen is our upper back will compensate. And by what I mean by that is our upper back will round like this to reach towards our toes. what we're looking for is mobility in the pelvis without shooting your bottom back. So I want everyone the best you can to reach, whether it's your thighs, your knees, wherever you can reach. So we're going to do a test by folding forward from the waist and hanging down and relaxing here. And relax is a relative word, right? So just make a mental note or a note where you're able to reach to, and then come up slowly. So now I want everybody to remain standing, but turn your feet out to the sides. We still have about a fist width distance between your heels, and we're going to relax standing here, and we're going to squeeze your glute muscles or your buttocks. So go ahead and contract and release, and contract and release. And I'm just moving my hands like this to kind of give you a visual of what I want you to do, but really relax and rest your arms down towards your sides comfortably. I want you to make sure that you're not squeezing your thigh muscles, you're not squeezing your abdomen, or anything else beside your glute muscles. And if that is happening, just make a mental note of that. So go ahead and squeeze and release, and squeeze and release. Also notice if your glutes are firing differently. So one before the other, or are they together? And then let's go ahead now and turn our feet straight forward. Again, it may feel like you're turned in, but we want the sides of your feet straight forward. Relax your arms and squeeze your glutes again. Squeeze and release, and squeeze and release. And in this position, we may notice it might be more difficult or more easy. And it's really showing how position really matters. So whether your feet are out or in plays a big difference on how we can fire different muscles and mobility. And in this position, the standing glute contractions, keep going, promotes proper weight distribution in the standing position. So shoulders over hips, over knees, over ankles. Great. Let's do 3 more. 1, 2, and 3. So remaining in this position, I want you to grip the first part of your knuckles and turn your thumbs down with your palms out. Put your hands at your temples and open your elbows back as far as you can, and come together as close as you can without using your upper back. So it's not a competition, and it doesn't matter how close together you come. So if you can only come together like this while rounding your back, that's not the goal here. We're opening and closing, and opening and closing. And again, making sure your feet are about a hip or a fist width distance, and open and close. And this exercise promotes proper position of the load joints, as well as performing thoracic flexion and extension. Great. Let's do open up enough so you don't see, if you can open up far enough so you don't see your elbows and your side vision, that's really great. And wherever you can come, here, here, or here, anyway. So let's do 5 more. 5, 4, 3, 2, 1. Wonderful. We are going to do one more exercise. And if anybody, or if you have a chair next to you or a place you can sit comfortably for this exercise, that's what I recommend. I'm going to turn the chair to the side, and I'm going to sit down. I'm going to make sure that your knees are level here. One is not in front of the other, but we're even. I'm going to take my left arm and grab the back of the chair. We're going to work on sitting up properly, and it's not from our chest, it's more from your pelvis. So you're going to roll your hips forward. Let's practice. The first thing to do is to slouch, okay? We're going to slouch first, and then we're going to roll our pelvis forward so we can see that now our load joints are stacked. Take your left hand and grab the chair behind you, right hand on your legs, keeping a fist width distance between your knees. And we're going to rotate. So we're not rotating from the pelvis. We're not rolling forward so this back knee comes. We're keeping level here. And this is great for a lot of you golfers that are getting back on the course, that you can do a twisting exercise without having to lie down on the green or lean up against something, but you can do this on a bench. You can do this on the golf cart. And obviously what we do in one direction, we need to do in the other. So let's twist and breathe and breathe. Great. We're going to untwist and switch sides. I'll scoot my chair over for a bit. Sit on the other side of the chair here. And again, we're sitting on the edge. And as a reminder for some of you who have shorter legs, to put some books or something on the floor so that your feet are flat and you're level out from your hips. So you don't want to be leaning forward this way or up too high. We want to have alignment straight out from your pelvis. And again, keeping your knees level, rocking forward in your pelvis, grab the chair behind you, place your hand on the outside of your leg and really twist. Breathe. And notice one side may seem more functional or more smooth than the other. And a lot of times rotating this way is something that those of us who have been driving without backup cameras can relate to, because we used to have to put our hand around the passenger seat, grab the steering wheel and look back. So this is more of a motion that our body's used to, but we really don't do this anymore. Good, keep twisting, keep forward in your pelvis, not your chest. Just take 2 deep breaths. Oh, great. Unwind. Wonderful. So we are going to now check the mobility of our pelvis. So I talked about the mobility of your pelvis in relation to your upper back. So go ahead and stand with your feet straight forward, about a fist width distance between your legs or between your feet, and go ahead and fold forward again. You're bending from the pelvis rather than scooting your bottom back or rounding from your shoulders. Really reach down as far as you can and let your head hang. And if you can, try to tighten your thigh muscles. Try to squeeze. And some of you may notice that you can reach farther or that it was easier to get into that position. And this is a prime example of showing that your hamstrings don't really have the flexibility of your hamstrings aren't the only thing that matters, or really not really matters much about the functionality of your pelvis. So your hamstrings can be really loose, but if your pelvis doesn't move, you can't reach down. So we didn't do any stretching hamstrings exercise right now, but a lot of you will notice that you can reach farther down to the floor. So again, these are just some simple exercises in a specific order that can help you with more mobility. And who doesn't need more mobility and function with ease? And then let's do a posture check one more time. Go ahead and just stand there, close your eyes, and notice the weight on your feet. Some of you may feel more even. Some of you may notice less swaying. And then go ahead and open your eyes and check your hand position. So we want our hands to be here because our hands are the windows to our shoulders and our feet are the windows to our hips. So find out where they hang naturally. Great. And I always like to ask my patients, what would it look like if you had no limitations? So with more mobility equals less limitations. So that's a great thing too. So thank you very much for participating, and let's move on to meeting our patient Hal that we're all here for today.
All right, so Hal, just a little background. He's had multiple treatments with us, various stem cells and platelet-rich plasma injections, anywhere from bad arthritis in his ankle, arthritis in his back, as well as stem cells into his shoulders and his rotator cuff tears. So now Renee will go a little bit of background about what they've done, and then we'll start chatting with Hal about his experience.
Yes, so we see some of Hal's background here. He's a golfer, really good golfer. And he was experiencing some of these limitations. So unable to stand to shave without low back pain, unable to get going in the mornings without warming up, unable to play golf on consecutive days without paying for it the next day or several days. So he would decide to play golf and then be out for the next couple of days. So it's cost benefit. And then unable to walk for an extended period of time without stopping to lean or rest against something. That's pretty limiting. So here is Hal's before picture. And we can see by the plumb line, his body is offset. We can see that his feet are turned out to the sides. And we can also see that he has rounded shoulders and a bit of rotation in his body.
He also has a pretty good farmer stand on those stock lines.
Yeah, hence the golfer. As a result, with working with Pain-Free Body after he had his stem cells, he was experiencing the following successes. Hal was able, after 3 weeks after his initial visit with myself, Hal was able to play golf for 4 consecutive days pain-free. I mean, probably physically pain-free, but not mentally pain-free, right? Golf, golf has that way up for us. This work has allowed Hal to improve his golf game, resulting in his ability to drive the ball farther. And again, who doesn't want to drive the ball farther? And Hal was able to go to an event without having the tired back feeling, so he was able to participate and converse with people. And then Hal mentioned that his morning routine was upgraded to being able to wake up and complete his morning stretches without complications or pain. So he could get up and get his day going instead of having to get up extra early to get ready to get his day going. Here's a remarkable after photo here. You can see that the plumb line is a lot more even. His feet are pointing more straight forward. His hands are falling more naturally. And the biggest one, Hal, I want to say is that you're smiling. And that's a great thing when we're out of pain. And we can see here kind of before and after photo side by side. It's pretty remarkable. So we're going to actually meet Hal here. Thank you for being with us and working with Dr. Markle and myself. And can you answer, what does this functionality mean to you as a patient, Hal?
Well, the functionality gives me the freedom to do what I want to, but I'd like to back up to where I came from and how I got to where I am today, if it's okay. And first of all, thank both Centennial Schultz Clinic and Renee and Pain Free for having me there. So back in '07, I was getting ready to, first of all, I refereed basketball, the high school and college level, for 35 years. Pretty much destroyed my foot to the point where I needed reconstruction. Had 3 reconstructive surgeries. And keep in mind, this is the foot. The third surgery screwed up my ankle. I was 3 weeks out of an ankle fusion, and I ran across the Centennial Schultz Clinic and the concept of stem cells. And so I had a procedure done. Dr. Centena, who was the original owner, it's before Dr. Markle's days, did it and did two sessions of it. And 3 months after the second session, I found myself jogging to my car after an Avalanche game. I subsequently just kept doing my thing, playing golf, completely retired in 2012 for the first time. Around the middle of 15, 16, I was starting to have some exasperated type back issues. And I went back into the Centennial Schultz Clinic and I had some treatments on my lower back. And they suggested at that time to get a hold of Renee and start working on the Egoscue method, of which I knew nothing about. And at first, when I researched it, I thought it was kind of hokey. But I decided to try it. And boy, it sure, you saw what Renee did. It looked like mundane exercises, but they aren't mundane exercises. And they really built me up. And again, within 4 to 6 weeks after the first session, I was able to play golf 4 or 5 times a week, do what I wanted to do. I built up to where actually I played 6 days in a row. And ironically, the 7th day, I had a real serious car accident in July of 2018, which was very frustrating for me and a big setback. Tore up my shoulder, lower back and neck were injured again. And it took about 4 or 5 months till I got to where I could even have a treatment. Dr. Markle worked on me, if I remember correctly, for about 2.5 hours, both a combination of stem cells and PRP, 5 different body parts. And about 3 weeks after that, I started back with Renee, almost from day one. And we rebuilt it up. Last golf season was frustrating, but by the end, I was back to playing. The last month, October, I was able to play 3 or 4 days in a row. And then, lo and behold, in November came the snow, and that was it. And most recently, my son has quarantined me if I want to continue to see my grandchildren. I haven't spent much time on the golf course till this meeting's over, and then I'm headed out there. And I'm grateful. I was blessed to find them. It was one of these quirky things, and they both groups have done phenomenal things for me. We took a trip to Europe, actually to Normandy, and last October, and I was able to keep up with the whole group. Sometimes, 3-4 miles a day and walking, and I was able to keep up even though I was really nervous before I went. And be willing to like to entertain any questions you have or wherever I want to go with this.
Yeah, we really appreciate Hal being with us today as well. Alrighty. Well, I really appreciate everybody's time. So you guys take care and stay tuned for next week. And we'll be sending out the topics over the next couple weeks. We're going to have some various providers come through, as well as some additional patient come through as well, so they can discuss about their rehabilitation and things they've done. So really appreciate it. Take care.
Yeah, thanks everyone.
Thank you.